Okay. Well, so what are some things people can do to keep healthy? What they can do.
People tend tend to work out. Can what the words relate instead of do exercise, work out maybe. Okay, people can work out and consume the healthy food. Mm. Take a rest regularly. Uh, think positive. Positively.
Lee.
Mm. Help people. Help others. Um, mm, uh, Communicate with others. Mm, Live in a clean and healthy environment.
Grace.
Mhm. Mm, yeah, that's all.
Grace, yes, of course. Well, so let's see. Yes, you're right. So they can walk out and consume healthy just food. So yes, go for a walk maybe is better. So walk out, go
Uh,
for
go for
walks.
what?
Of course.
Yes,
And consume is okay, but consume is a little bit maybe just formal. So why not? Eat is good. So why not? This is
yeah,
actually
it's
a conversation, of course. And of course, they can get enough rest. Yes. And think positively. That is really important and separate others. And so you can say they can, of course, live in clean and healthy environment. It was good. Okay, so we can have it. Well, let's see. I definitely agree with you. And um, okay. What is the healthcare service like in your country? So, okay. What is the
where is the healthy care
healthcare
service like?
service like in your country?
I think we have a very good health and care service. If we have money, mm,
Yours.
we um maybe the doctor I mean the doctors is very good. They have a uh, good skill to treat or to cure people, but we have to pay a lot for healthy healthcare service. If not, we cannot use the good service, good medicine, and a good doctor. We don't have those um, because the government uh, was the government is not rich enough to cover on the health care expenses for the residents. So we have to pay for ourselves. Mm,
How about insurance?
insurance. We don't have. Uh, we have the insurance that is used by the government, but I don't know why we rarely use it. Um, because the procedure and is very complex. They require a lot of documents. Uh, yeah, so we have when in the emergent cases, we have to pay by um, uh, by ourselves, or we have to buy the private insurance.
Ah, got it. Yeah, got it. So it's like because the process is complicated, right?
Yeah,
And it requires not document, you can say a lot of paperwork.
paperwork. Yeah,
Yeah, of
yeah.
course, maybe paperwork. Yeah. So you have, as you said, just as I realized, just let me confirm it. So it's like you technically have a government supported plan, yeah? It's like government supported plan. I mean insurance, right? But it's rarely used.
Answer my phone, please.
Sure.
Alo. À, cái phone chị cái đó là cái gì không? Ờ, ok, ok. Chị chuyển khoản khoảng 10 rưỡi chị chuyển khoản. Chị đang có cái hộp online xíu. Ờ, ờ, 070831 rồi khoảng 10 rưỡi chị chuyển cho. Cảm ơn. Ok.
Okay, so uh, just a government supported plan. I was talking about this, you mean because you said it's used by government, but I didn't catch that part. So what you mean is the insurance that is used by government? I was like maybe you meant government supported plan, like for people. But of course, you rarely use it because it requires a lot of paperwork, so you tend not to use it, yeah?
Ừ,
And pay out
đúng.
of pocket, yeah? So
Yes.
pay out of pocket.
If we use the government insurance, we we cannot reach to the good medicine, good service.
Ah, got it. So you can get, yeah.
Yes, my parents come to the hospital and they use uh, the insurance that is used by the government. The insurance. Uh, so the doctor said that if you use this insurance, we have to give you this kind of medicine, not effective medicine, for example.
Oh,
Yeah, not good. Yeah, you can use this one only,
oh.
not this one. So if you want to this one, you have to pay more. You have to pay
So not
more. Yeah,
just human insurance doesn't cover just,
yeah.
everything. Like, if you use this insurance provided by the government, maybe you can't get good services. Yeah, when you go to just medical centers. Yeah, got it. Why? It's not fair, but you pay for it.
We pay for the government insurance from the government is not expensive. We can buy it with a little
Yeah.
amount. Mhm.
Got it. So because of
Mm.
this, maybe you might not get access to high quality service. Like because of this. Yeah, got it. Okay. Okay, so let's see. Just I want to talk
But
about
I want to confirm that the doctor, we have the skilled worker, doctors, nurses, they very good.
great
They
doctors.
have a good skilled,
Yeah, highly skilled. You mean highly skilled.
highly skilled. Yeah,
Yes. Yeah.
maybe medicine, medical officer, right? Um,
Sorry.
we how can we call the doctor, nurses, the worker in the healthy care? How we call them?
I,
Officer.
I can get why you
How
exactly.
we can how we
How
can
we can
the
call, okay, so how we can
call
call
how we
doctors
can
and nurses
yeah,
work at hospitals?
yeah, worker.
So you mean,
Uh,
okay, so you mean in general, for example, one word in
yes,
general, or
yes,
just
yes,
like
yes,
just one by
yes,
one? Because
yes.
normally we say doctors,
General.
you know? So what you said, okay,
Mhm. I
I
want to say that the doctor and nurses they have a high skill, high they have a high skills
yes, it's
in
okay.
treatment, for example.
Yeah,
So
I can get your question.
I want to, uh-huh, uh, maybe the medical work officer, medical
Oh, it's not,
officer.
we don't have something like
How
this, but
can
I
we,
can get what you
oh,
exactly mean.
okay. Mhm.
Yeah. Human, just because they're human medical staff, human this, I'm not, because healthcare workers is not like human medical staff or hospital staff. I'm not care, I'm not sure what you want to say.
Yeah, maybe we have to talk to doctor and nurses, not have the name for all of them.
No, no, we do. We have different names, but I'm not sure what you okay, let's talk.
Mhm.
Let me divide them into different categories. So if you mean just doctors and nurses, you can say, for example, healthcare professionals. It's okay. Or medical
Have
staff, or maybe medical staff is good.
medical staff.
But
Okay.
you can't use one word in general for all people, who work at a hospital. For
Okay.
example, everyone, everyone, not doctors, okay? Working in a hospital, like, I don't know, cleaner, like, etc. So, all the people. So we have workers and hospital staff. As I told you, we can't have one word in general for all people, but doctors and nurses, they're different. So we can say healthcare maybe professionals.
Yes. Okay. Healthcare professionals
Okay, but if you mean,
have a good,
sorry, but
yeah.
if you mean, what is this? If you mean people who work, just work in hospital, for example, hospital
Oh,
staff.
okay. Yes, I
Maybe
see.
this one, but this is about workers, not doctors. And
Mm-hmm. Okay, work.
let me see another one. Okay. Uh, if you want to have a general term for all who provide care, all who provide care, so maybe healthcare provider,
Okay.
maybe
Okay.
this one.
Provider.
Yeah.
Oh,
But yeah.
I think healthcare professionals is okay.
Yeah, of course. So different terms, but it's not like
Yeah.
this in
Thank
general.
you.
Yeah. But officers is completely wrong. We don't have this. Because I was, when you say officers, I was like, you're talking
Mm,
about,
yeah,
yeah,
right.
guard. I'm not sure you are securities. Maybe I was like, you were
Come on
talking
Friday,
about
I'm looking
security.
for words or right words.
Yeah, which sometimes can be a little bit confusing. Well, okay. Just let me drink a little water. Really, I'm losing my voice. Okay,
Mm.
the next one, let's see. Uh, oh, so are your parents healthy? Of course they are. Why not?
Yes, there.
Fortunately.
Mm-hmm. Uh, they don't have any disease, serious disease. My dad, father is over 80, and my mom is um, um 73.
Yes.
They can do house chores every day. Mm, they can ride motorbike. Um, they and cooked by themselves.
That you're in good health
They take
already.
care of them. They take care of each other. Mm, I think at that age, they're healthy.
Yeah. Uh, yeah, actually, I was thinking about another question when you were talking. I want to ask it. So let's talk about your answer. Then I will ask my question. It's not related to this one. That this is this is my question. So maybe I'm a little bit curious about it. So yes, that is really good. They've never had any major health problem.
Nature.
It's like
Mm,
casual version. Okay.
mm,
They are super active, you want to say? They doing
yes.
chores, cooking, riding motorbikes, and they living independently, you mean? Yeah. So that's perfect. Well, this is not about actually this part, but I want to ask, what's it like to have parents at our ages, like when they get just old, I mean.
My parents,
No, just
what's
in
like?
general, what's it like to have parents at our age? Because I think that me and you, just we are at the same age somehow. So I feel like just, I was thinking about it because it was like, I want to know when we get older, like, what is it like, to have parents now after marriage? Now you have your own children, own kids. Now you are mom and you have your parents. So what's it like?
Mm,
Because I think it's nice to have someone always in your corner. Just
maybe if I will be, I I will be my mom. Um, uh, I will be like my mom. She's active, really active. She um, thinks positively. She participate to the communities, and sometimes she go out with her friends. Uh, she and have a cafe together. Huh? Uh, she has some uh, community uh, activities contributing to the community.
Yeah.
She does business well. She
Yeah,
does this
actually,
business.
I want to just maybe paraphrase my question because I was asking
Yeah,
something else.
yeah.
Yeah. Actually, I was asking about maybe uh, when you're an adult now, of course, what is it like to have parents, you know, now at this age? Okay, let's talk about maybe responsibilities, maybe like just I don't know, relationships, okay, with your parents. If this relationship changes, when you get older. Yeah, I'm asking this. So for example, compare because my experience actually back into maybe I was 16 or 17. I'm asking you now at this moment, at this age, okay, tell me how has it changed if this relationship, maybe this relationship can become more balanced, maybe more respectful, maybe different. I'm asking you about this relationship.
Mm. Uh, Relationship. I think when I get older, I love my parents more because I think about the data they will live. They don't have much time to live with me, so if I spend more time for them. Yes, I don't I don't take care much of my children anymore because they mature, mature. Yeah. Uh, so also I will spend my time for my parents. Mm, and will come to visit them more often. And I think they get old and they cannot walk. Uh, they cannot walk easily. I will help. I will live with them, or I can bring them with us um, to take care of them until they die.
Oh, yeah, it's like,
Because
uh,
I think that this time, maybe 10 more, from now to 10 years more,
of
um, they quicker and quicker.
course,
When they get
you're,
90s.
yeah, actually, you're
And
expressing
I think they need me a lot.
grace.
Yeah, I go to, I will take them to hospital, go supermarket, cook for them, and
Yeah,
mhm.
actually, you are expressing like real love and gratitude, like emotional maturity. Now, it's so it's yeah, good that when you get older, of course, you find yourself just loving and appreciating, loving. You find yourself loving and appreciating your parents even more. Maybe because you know that one day they won't be here with you, of course. And that that thought makes you want to spend more time with them while still can. And of course, your children, as you said, are grown now, and you can take care, of course, themselves. They can take care of themselves, and you started focusing more on your parents, and you visit them more often. And that was so good, actually, emotion that when they're no longer able to move around easily, move around. When they are no longer able to move around easily, you will be there to help. I
Yeah.
will be there to help, whether it's living with them or bringing them to live with you. So you want to take care of them until the very end. You said until they die. I say until the very end. Like it's soft and emotional phrase to say until they die. So thank you. Yeah, good answer. Yeah, I wanted to notice. Well, let's keep going with the topic health. And
It's healthy food.
yeah,
Mhm.
this one.
Do you always eat healthy food? Not always. Sometimes I eat, um, or sometimes I eat the food of the yesterday I or I keep the food in the fridge several days and I eat them. I think it's not healthy. Um, I I don't eat junk food, unhealthy food. I don't eat, but I think I should not keep food in the fridge um, too long. Mm-hmm.
Yeah,
Mm-hmm.
like
Yeah,
okay,
that's
maybe,
all. Yeah.
but sometimes, so it's okay. Sometimes, why not? Who said that, you should always eat healthy food? Who said? Okay, you mean you ate leftovers.
Mm.
Leftover, yeah.
Leftovers.
Leftover something, actually, I don't know, food from, for example, during the week, just you have some food and you can eat, of course, so leftovers from the day before. So you have some food from the day before, so you can eat it. And yeah,
Mm.
why not? So but it was like for a few days, maybe it's a little bit just like, but it's okay, it's still fine. Yeah,
Or
yeah.
my sister in the US, she keep the food set and she's kept food in several months
And freezer,
in freezer. Uh,
yes.
yes, and she eat. She can eat. Oh, I'm afraid that I afraid of eating the food and eating the leftovers.
No, it's okay. If you have it, for
But
example,
frozen,
yeah,
but we keep it frozen. Is it
sure.
okay?
Of
Right?
course, yes. If it's in freezer, of course, why not? You can keep it for month even, but it
Mhm.
depends. So how to keep it, that's really important. Yeah, but it's okay. Just if it's frozen, it's okay. It's still that. Maybe not that just you can't expect that quality, but it's okay. But still okay at least. Yeah. Okay. Let's see. Just we're running out of time. Let's log out and back in,
Yeah.
and then we'll keep going. Okay.